A 52-year-old architect was referred to me by his primary care physician because of vague symptoms which eventually led to a diagnosis of pancreatic cancer. Now, this gentleman seemed to be the picture of perfect health. He exercised in the gym every day, ate a healthy diet, and did not smoke or drink alcohol. But he still developed an advanced pancreatic cancer, and this happens more often than you would think. Pancreatic cancer is often called the silent killer. Why? Because unlike other cancers that might form a lump you can feel, pancreatic cancer hides deep within the abdomen, often growing without causing any pain until it's advanced. But silent doesn't mean invisible. There are warning signs, if you know where to look. I am a board-certified medical oncologist specializing in the treatment of all kinds of cancer, and I'm going to walk you through the 7 specific symptoms that should never be ignored. Number 3 is the tricky one, as most people mistake it for a simple backache. But let's start at the beginning. Symptom number 1 is jaundice. This is often one of the first warning signs. It manifests as a yellowing of the skin and the whites of the eyes. This happens when a tumor in the head of the pancreas blocks the bile duct. Bile is a chemical substance made by the liver to help us digest our food. It contains a dark yellow chemical called bilirubin, which gives bile its characteristic yellowish-green appearance. It is sent from the liver to the intestines through the bile duct. When a tumor blocks this duct, the bile can't pass through, so the yellow substance called bilirubin builds up in the body. This turns tissues, including the skin, yellow. Now, some people have skin so dark it might be hard to see the yellow color, but the trick is to look at the whites of the eyes. If you look in the mirror and notice a yellow tint in the whites of your eyes, this is an immediate red flag. It is never normal. Now, if you see this, I don't want you to panic, as there are several benign causes of jaundice, such as inherited enzyme deficiencies, gallstones, medications, and various forms of hepatitis. The key message is that this symptom should prompt an immediate evaluation by your doctor. Closely related to jaundice is symptom number 2, color changes you would notice in the bathroom. Excess bilirubin doesn't just turn skin yellow, it turns urine dark brown, almost like the color of strong tea or cola. Conversely, because bile isn't reaching the intestines to break down food, the stools may become pale, clay-colored, or gray. These drastic color changes are the body signaling a blockage of the bile duct. I tell my patients that the important thing is the word change. Cancer in general is a dynamic process. It tends to change within the body over time. When I talk to my patients, I am listening for clues, and I want to know everything relevant about their health. I'm more concerned about a symptom that is new or worsening than about a symptom that has been there and has not changed for many years. But if there is a change, I definitely want to know about it. Number 3 is the one often missed: mid-back pain. Now, I know what you are thinking. Hey doc, I get back pain all the time. This does not mean I have pancreatic cancer, does it? And you would be right. There are multiple other causes of back pain, including muscle strain, disc problems, pinched nerves, and so on. But this is different. As a pancreatic tumor grows, it can press on the spine or the nerves surrounding it. The classic description isn't just back pain, it's pain that starts in the upper abdomen and radiates straight through to the back. It might feel worse when lying down flat and slightly better when one is leaning forward. Remember the architect we mentioned earlier? He assumed that his back pain was due to lifting weights in the gym. The key thing is not to ignore any new persistent back pain or assume it's not serious. Talk to your doctor. Symptom number 4 is unexplained weight loss. We aren't talking about losing a few pounds after a diet. We mean significant weight loss when a person is eating normally. This happens for a number of reasons with many different types of cancer, because they all have some things in common. First, cancer cells are metabolically active and consume a lot of energy while growing and dividing. This results in the cancer consuming the body's nutrition. In addition, the body burns calories and expends a lot of energy trying to fight the cancer. Also, the presence of a cancer in the body can decrease the appetite, although this is often a late sign. In the case of pancreatic cancer, there is an additional factor leading to weight loss. Normally, the pancreas is a digestive organ, which produces enzymes to help us digest and absorb our food. When the pancreas develops a malignancy, it can no longer produce adequate amounts of these enzymes. The lack of pancreatic enzymes means the body can't efficiently absorb nutrients from the food one eats. Weight loss happens in many kinds of cancer, but it is particularly prominent in pancreatic cancer because of this additional problem of malnutrition. Number 5 is a major red flag: new onset diabetes. The pancreas produces insulin, which is essential for keeping the blood sugar in the normal range. If a tumor damages the insulin-producing cells, a person might suddenly develop diabetes, even if he or she is not overweight and has no family history of it. How would you know if you have developed diabetes? It often is diagnosed when a person notices constant thirst and a need to urinate frequently, leading to a visit to their doctor when they are found to have high levels of glucose in the blood. If you are suddenly diagnosed with diabetes as an adult without the usual risk factors, ask your doctor if you might have a tumor of the pancreas. Number 6 is something most people wouldn't want to talk about, but medically it's important: steatorrhea. This means greasy or fatty stools. Because the pancreas makes enzymes that digest fat, a tumor can stop the normal digestion and absorption. The result is stools that look oily, float in the toilet, and smell unusually foul. It's an unpleasant symptom, but a critical clue that something is causing problems with digestion of food. Now you may be thinking, how do I discuss something like that with anyone? I had a patient who hesitated to tell her primary care doctor about foul-smelling stools for 2 months because she was embarrassed. Remember that this particular symptom is very important for your doctor to know about. Don't be embarrassed. Your doctor has heard it all, and it will really help with reaching the correct diagnosis. Finally, number 7, itchy skin. When bile drainage is blocked by a pancreatic tumor, chemicals in the retained bile build up in the skin. These chemicals cause irritation and severe itching. Patients often visit dermatologists thinking they have an allergy, not realizing the root cause is internal. Typically, the itching does not get better with scratching. If you are itching all over without a rash or a history of bug bites, pay attention and see your doctor as soon as possible. Let's recap these 7 symptoms. Jaundice, also known as turning yellow. In an adult, this should always be evaluated. Changes in the color of the urine or stools. Persistent back pain. Unexplained weight loss. New onset of diabetes mellitus. Steatorrhea, otherwise known as fatty, oily, or greasy stools. Persistent itching. Having one of these symptoms doesn't guarantee you have cancer, but if you have jaundice or a combination of these other signs, please see your doctor immediately. Pancreatic cancer is treatable if caught early. We create these videos to help you understand your body better. Subscribe to our channel for more plain language explanations from physicians who care.